Good afternoon, everybody. I'm Sayumta from Bladder Wellness Team. I'm sure all of you must be keeping good health. Please vaccinate yourself and do wear mask when at public places. OAB, or an overactive bladder, is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. Let's unite to raise awareness about incontinence-related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of an overactive bladder, today we have with us renowned Dr. N. Nagarajaiah. Dr. Nagarajaiah is Senior Consultant Urologist from Bangalore. Doctor have 26 years of rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. N. Nagarajaiah. It's a pleasure to have you with us, sir.
Thank you.
Doctor, as today we are going to discuss about an overactive bladder and everything associated with it. First of all, we would like to understand what is an OAB. How can we know the symptoms, etc., of an overactive bladder?
Overactive bladder is the one symptom complex where bladder contracts more than required. That means more frequently or more urgently it contracts. The possible reasons being it can be just infection of the bladder or any neurological things, nerve weakness of the bladder, like diabetes, like any spinal cord problems, or even sometimes your bladder capacity itself can come down because of so many reasons that reduce the capacity of the bladder so that you need to pass urine frequently. Sometimes there will be obstructions to the urine outflow. Such case also bladder becomes overactive by overcontracting. These are the few common causes for overactive bladder.
Right. And when we talk about these symptoms, as you have already stated that, you have that sudden urge of urination, or you feel that your bladder is already full, you need to go and relieve yourself. What are the other major symptoms associated with an overactive bladder?
Yeah, one is frequency during daytime and nocturia. That's nighttime, patient getting up more than 2 times. The next symptom is urgency. Patient feels to go to urination urgently, and sometimes because it's urgency, before patient reaches to the toilet, he leaks urine. So sometimes incomplete emptying, what we call. Even the bladder contracts, patient will not be able to empty the bladder. So these are all the commonest symptoms. Sometimes patient can have like burning or pain during urination.
Right. So these are the major symptoms associated with an overactive bladder. Now, as you have also explained the causes responsible for an overactive bladder, I would also like to know that, because there are patients who say that with age, I develop these symptoms, or as I'm diabetic, I have these symptoms, or I have enlarged prostate issues, so I have these symptoms. So are these symptoms just associated with aging or being a diabetic, or in men because prostate issues are quite common after a certain age, or anybody can have these symptoms?
Yes, actually anybody can have these symptoms, but normally with aging the symptoms will increase. Okay. The possible reasons being, as you said, one is diabetes, more common in age, and the neurological weakness are more common as the age advances. And development of prostate also increases with age advancement. Even in females also, the atrophy changes in the vagina and urethra, the increase with aging. So age itself is one of the risk factors other than the other causes what I mentioned.
Right.
Even though it can happen in any, even including children can happen. See, like in infection can happen in children also.
Right.
So they will have frequency, urgency, and all those things.
Right. So it's just not with age. There are other, people also associated who can have OAB. Now, the thing is, normally with aging and with patients who have sugar level issues or who are diabetic, they have this notion in their head that as I'm aging, I'm bound to have this, or as I'm a diabetic patient, I'll have these. So they start living with the condition, even if that hampers their quality of life. What would you like to tell those patients?
Yeah, that's what So majority of patients, they think because of age I'm suffering this, they'll silently suffer that. So not necessarily, there will be other associated causes which can be treated completely to 100%. As I said, well controlling of the diabetes, treatment of any obstruction to urine like prostate, stricture, or any stones in the bladder or in the tract, they can be completely treated. So don't neglect it thinking that it's because of age. Go and contact your doctor. There are solutions available for all the causes. So sometimes it can 100% curable also. So it's a very misconception. Many patients will say that, no, doctor, I was already, it's because of age, I just kept quiet, and they come in the late stages where it would have affected already bladder, kidneys, everything. So I advise them not to neglect it.
Very well said that, it's not a good thing to neglect it. Anyways, you won't be able to ignore the symptoms, because if you have those urgency or other related symptoms you have, it's definitely, affecting your quality of life. So it's better not to neglect those symptoms. Please go and consult your urologist. That's really important. And as Dr. had very well said, that it's curable, in many cases, complete cure is there. So please go and seek help. Doctor, now, as you were just, hinting about the treatment options, we would like to know in detail the treatment options available for an overactive bladder.
Yeah, the treatment, there are two aspects. One is, first we have to diagnose what is the causing the condition. So for such diagnosis, what we do, simple such as urine examination to know any presence of infection, and the ultrasound examination that gives us any capacity of the bladder or any foreign bodies like stones in the bladder and obstruction like prostate, those things it gives. Then if required, a higher test, sometimes CT scan of the spine and the head, rule out any neurological causes. That is we can. So once we diagnose, then the two, one is to treat the cause. The second thing is to treat its effects of the overactive bladder. But treating cause, as I said, if any foreign body like stone is there, remove the stone. If prostate is there, treat the prostate. If any neurological things there, you manage them. Then as it is per se, overactive bladder, there are medications available like anti-muscular we call, anticholinergics we call. That's one aspect. Medication is one aspect. The second most important aspect is the lifestyle changes. The lifestyle changes, you have to adjust to the bladder in the sense, see, try to avoid long journeys, long functions or social functions. So you just, to some extent, you get used to the lifestyles for the overactive bladder so that you will not have embarrassment of leaking urine in the functions or social stigma, all those things. So some lifestyle changes. And the third thing is the diet. There are some diets which increases the overactive bladder urinary incontinence. Say like irritants, we say like alcohol, smoking, or any like spices. Those things tend to increase the symptoms of overactive bladder. You try to avoid those things. So once your lifestyle changes and diet is over, next comes our medications. There are effective medications available to treat the overactive bladder. Once, even then, with medication not controlling, there are some surgical procedures also available to treat the causes of like prostate or stricture or stone. So it can be treated.
Right. So it can be treated either by some lifestyle modifications or, keeping a good diet chart or with medications. And if nothing is working, then of course, surgical options are also available. Now, doctor, I would also like to understand that, in female, you said that, because urethra or due to vaginal issues, they also are prone to an overactive bladder. Now, the thing is, especially after menopause or after giving birth to a child, they tend to have the weakened pelvic floor, etc., the issues they, come across. And they again lead to incontinence related issues or an overactive bladder. So from a woman's point of view, what are the things that is essential to prevent OAB or incontinence related issues?
Yeah, one is like childbearing age, So during the childbirth, so if you neglect the labor, the child head and comes at the impacts in the pelvis and compresses the urethra, that's urinary passage, leading to ischemia, decreased blood supply, and later in life it leads to what we call fibrosis. Normally, urine passage is elastic; it expands once the urine comes. So that elasticity will be lost, because of ischemia and lack of blood supply during childbirth. That's why that's one aspect. Managing the childbirth is one aspect where don't try to prolong the labor once pain starts. The second thing is after menopause, as you said, rightly said, the estrogen hormone, which is responsible for elasticity of the tissues in the vagina and the urethra, that is urine passage. So it will come down. So that again leads to what we call loss of elasticity or fibrosis. So these things will increase the possibility of obstruction to the urine flow and the overactive bladder. So we give some medication, as I said, estrogen medications to prevent or prolong the things. And of course, if any patient develops tight urinary passage, we try to dilate it and widen it. So simple measures are available to treat them effectively.
Okay, and can Kegel exercises or exercises to strengthen their pelvic floor, they can also
to strengthen
that? Okay, right. And when we talk about men, because in men after a certain age, prostate enlargement issues are quite common. They also go through the same symptoms, but probably they won't know that it's because of an overactive bladder or what are the reasons responsible for it. So what would you like to suggest them?
Yeah, see what happens, as I said, once prostate starts growing, say after 45, 50 years, so gradually it causes obstruction of the urine flow. So initially the bladder overworks. So after overworking, bladder becomes hypertrophic. It loses its again normal capacity and tone. So even after treating the prostate, it may not come back to normal. So the overactive bladder will persist. So that's the reason you should not neglect the symptoms for long. Immediate treatment has to be taken and we can treat effectively. So as you said, prostate is the commonest cause in the people say after 50 years for the cause of overactive bladder. The second commonest cause being, as I said, neurogenic causes.
Right. Yeah, doctor, as you said, neurological causes are also, responsible for an overactive bladder. I would like to throw you more light on this, how neurological causes, reasons are, causing OAB.
Yeah. See, one is diabetes. That's commonest in our India. Diabetes become very common and people neglect that because it's like a silent killer. They don't control it properly. The diabetes causes what we call autonomic neuropathy. Autonomic nerves are the ones which supply the bladder, which are responsible for contraction of the bladder. So diabetes causes weakness of those autonomic nerves, so that bladder becomes automatic. So it contracts on its own. The second common is the stroke. Now, generally, they call stroke, no? We call it cerebrovascular accidents. Particularly those patients who are having hypertension, that is increased BP. So they can have strokes. The stroke again affects and the nerve supply to the bladder. They will have overactive bladder. So the next, of course, in India, it's not like sclerosis. In Western countries, is very common. Mm-hmm. So all those things are common. In our countries, diabetes and the stroke, these two are the commonest causes for neurogenic causes.
Right. And doctor, when we talk that these are the, treatment options available, you said the first is lifestyle modifications and diet. Now, I would also like to understand that, especially in case of obesity and people who have a very badly kept lifestyle, how does it impact their bladder?
Yeah, as you said, obesity is again contributes to the overactive bladder in the ways like, say, obesity decreases the strength of the pelvic floor muscles. So because fat comes in between the muscles can't contract effectively. That comes. Secondly, overweight itself puts pressure on the bladder. So that leads to overactive bladder and incontinence of urine. So controlling weight is very important. Indirectly, it also causes control of diabetes. So in that way, obesity is a very, very important point. As I said, the smoking, alcohol, diabetes, obesity comes under also major risk factors for that.
Right. So it's important to check your weight as well. It's important to see that whether you are healthy or not in terms of weight, etc., or you have a healthy lifestyle or not. Doctor, I would also like to ask you that, for example, if a person who's watching this session right now and he says, oh, I have these symptoms. Now, what should that patient or what should that person do?
Yeah, suppose patient has frequency, nocturia, urgency, urge incontinence, leakage of urine before he reaches the toilet, or pain during urination, you should immediately consult the urologist. So they will do simple examination and history taking. By that itself, without any test, majority of the condition can be diagnosed. And if required, doctor will do simple tests, as I said. One is urine examination and ultrasound examination. By these tests, almost all the cases can be diagnosed and can be treated.
Okay. Can UTI, urinary tract infection, also cause an overactive bladder?
Yes, yes. It causes. It's a temporary cause. Like it's not long lasting. It's temporary. Once you treat, then patient becomes all right. So, but the infection is usually they develop burning and pain. Immediately they seek doctor's help. Whereas in neurogenic and others, they don't seek immediately. So it can cause temporary overactive bladder will happen because of infections.
Okay. Now we have few viewers who have their questions. Abhishek Mishra is asking, is OAB fully treatable in old patients?
Yes, treatable. Old patients.
Okay.
Fully treatable.
Oh, that's wonderful. Now, Rohit John is asking, daily having 4 to 5 cups of coffee will cause OAB?
Yes, coffee itself may not cause OAB. It increases the symptoms.
Okay.
As OAB symptoms like frequency, urgency, it increases a stimulant. So it increases symptoms.
So anything that irritates your bladder, like the excess of coffee or aerated drinks, or as you mentioned, chain smoking or drinking alcohol, they may actually increase or trigger your symptoms. We have Ashu Yadav asking, are there other lifestyle steps to take in order to manage an overactive bladder?
Yeah, as I said, one is reducing the obesity, that's weight reduction. Second, avoiding this foodstuffs, what I said, the irritants. Third thing, as I said, you have to manage your travel and social functions accordingly, so that embarrassment and social stigma will be avoided.
Right.
And of course, exercises. So it's very important, keeping good health, overall health.
Right. It's important to maintain a good lifestyle where you eat well, where you drink well, where you exercise yourself, and then you reduce the chances of having an overactive bladder. But in case you have these symptoms, please don't waste your time. Go and check with your doctor. Now, the thing is, doctor, that many patients are there, many people are there who don't even know that there is a term called OAB or an overactive bladder. They are just, suffering in silence. They have all these symptoms and they are just not going out and talking about it or going and seeking advice from a urologist. My question is, how bad can a neglected or untreated OAB become?
Yes, it can lead to many complications. One, as I said, for the patient, like social stigma. He can't attend the social functions, so his lifestyle becomes restricted. Then because he gets up in the night to pass urine, he can't have good sleep, so that the next day, the day will not be good. Then suppose, particularly if it is incomplete emptying and it starts building up in the bladder, it puts pressure on the kidneys. So because of incomplete emptying, patient can have repeated urinary infections, and pressure on the kidneys leading to sometimes kidney failure also. So the infections and kidney failure are the commonest complications other than social lifestyle difficulties.
So despite, other than hampering your quality of life, it can actually affect your kidneys and other organs associated with the urinary system. So it's always better to not waste time and go and consult with a neurologist. Nandini is asking, sir, if someone is leaking urine during laughing or sneezing, does it belong to OAB?
Yeah, OAB can also, there are other causes also. OAB is one of the symptoms of OAB. Particularly, it happens in, as you said, pelvic floor muscles weakness. It can happen. That can be due to either childbirth or any surgeries. Like we do prostate surgeries, pelvic surgeries, surgeries on the uterus, bladder. They can also lead to weakness of the pelvic floor muscle. That can lead to stress. We call it a stress incontinence. That means urine leakage and coughing, sneezing, all those things. So there, as you said, Kegel exercise, pelvic floor exercise has to be done, and there are some medications which are available. You can treat it.
Okay. Ankit Chaurasia is asking, during COVID, how do we manage it, and any do's and don'ts for managing OAB during vaccination as well? Any medicine which needs to avoided or stopped if we are going for
No,
vaccination?
not required. Not required. You can safely have vaccination. Whether you have OAB or OAB medication, nothing, it will not affect. You can safely have the vaccination.
Namrata Sen is asking, sir, can OAB problem also happen due to pregnancy?
Yes, it can happen. As I said, by enlarged uterus, it presses on the bladder, so that leads to frequency, nocturia, urgency, all those things. It can happen.
I'm getting a lot of questions regarding, what are the foods or beverages I should avoid to keep from making my OAB worse, or does smoking and drinking affect my bladder? So we have already spoken about it, but still I'm getting a lot of people asking these questions on the same line. Again, would you like to elaborate, how your diet and how your fluid intake should be, and what are the things that we need to avoid, doctor?
Yes, that's very important. That's the reason everybody keeps asking that. See, we say irritants, as I said, coffee, tea, alcohol, smoking, any of these spices, too much spices people will eat. That can also stimulate the bladder and causes OAB. And even irritated drinks like Pepsi, Cola, those things can also stimulate the bladder. So those things should be avoided as far as possible when patient has these OAB symptoms.
Right. So it's always advisable to have a healthy lifestyle, eat well, drink well, and avoid these things which irritates your bladder, like smoking, drinking, alcohol, or aerated drinks, or a lot of coffee. Now, doctor, one more thing I would like to ask you is that, many times, especially in India, we have this notion that drinking a lot of water is a good thing. And there is no limit of this lot of water. I mean, many people drink like almost 5, 6, 7 liters of water daily. What should be the water that, the limit of the water that we consume daily? What's the theory behind it?
That is another reason. Simply drinking a lot of water, that can again lead to OAB. So increased frequency, nocturia and all. See, just unnecessarily compulsory need not drink water. Say in summer around 3 to 4 liters, in winter around 2 to 2.5 liters should be enough. The criteria is your urine should never be yellow. That is, concentrated urine should not come. That is the criteria. And that too, you drink only during daytime. Night, you don't, once you get up, don't drink water, because that again stimulates the bladder and you need to get up again to pass urine. That disturbs your sleep. So only day hours you drink water. Night after, say 8, 9 o'clock, you avoid taking water to decrease the nocturia. That is night urine passage.
Right. So that's the, how you should actually determine the amount of water you should drink daily. Akanksha is asking that I hardly go 2 times in a day to urinate. Is it going to affect my bladder, or is it okay?
Yes. It's not good. Daily, see, normally we say at least 1.5 liters per day urine should come. So normal bladder capacity is around 500 ml. So probably she is overfilling her bladder if quantity is all right. If taking less water, quantity is less, of course, other problems will happen. If it is normal bladder with normal water intake, 2 times is not enough per day.
2 times is not enough.
More frequently, yes.
And what would you like to suggest her? Go and meet her doctor?
Yeah. Whether there may be some problem with the bladder sensations, like in diabetes or neurogenic bladders, people don't feel like passing urine. It just keeps filling their bladder. The latter sensations that has to be ruled out.
Right. So please don't waste time, Namrata. Go and check with a urologist, and stick to what your doctor is telling you. Trust your doctor. That's really important. Doctor, what are the most common mistakes that people often commit who have symptoms of an OAB? Like I can understand that not visiting a urologist is going to be one of them. What are the other mistakes?
Yeah, and other, as I said, sometimes they'll contact some local doctors or local non-qualified doctors, thinking that it's because of age or something. So they'll take some homemade medications. It may not control. So they keep on trying this one and that one, and by the time they come to the urologist, it becomes late. That they should avoid. Or if they can do some home remedies, it improves well and good. Whether it's home remedies, Ayurveda, allopathy, whatever it is. But they just keep on trying until last minute. That's not good.
Right. We have Akash Verma asking if my uncle's OAB gets better, should he stop taking the medication? I mean, he's asking that if he gets some relief, can he
Yes,
stop his medication?
yeah. Normally we say for 3 to 6 months we give medication. Patient is already, we just stop it and see.
Okay. And we have Meghna Mathur asking, does dehydration cause incontinence?
No, it won't cause. Indirectly, dehydration can cause urinary infections and that can cause incontinence, not directly.
Right. We have Aniket Yadav asking, are there any special instructions one should follow while undergoing the treatment?
That's all. We say to, as I said, lifestyle modifications and diet along with the medication, we advise that.
Right. As you also said, doctor, that a social stigma is associated with people who have an overactive bladder. There are people we have all come across who don't go to social events. Those they don't socialize at all. They don't go to any public place or any functions because they have this fear in their mind that what if they have a leakage, or what if they have this urge but then they don't find a loop to relieve themselves. Now, it do cause a lot of stress as well. So, yes, apart from treating the main issue, it's also important to address the stress. How do you, as a doctor, deal with that?
Yeah, we counsel the patient. We just counsel. We do interactions with them, counsel the patient, and there even the sometimes if it is not very well controlled with medication or whatever, there are other measures like using pads while going to the functions, or there are some clamps available for temporarily to block the urine until they come back home. So there are some measures like we say it's like not exactly conservative measures, palliative measures we call it. So not worry. There are options available for everything. Patients should not worry. They should follow the instructions properly. That's it.
Yeah, the good news is that it's curable, it's treatable. Yeah, there is, at least you'll get relief. You will get, what to do, what not to do. So please go and consult your doctor. Doctor, there are also many people, especially elderly people, who start wearing diapers because they know that they'll, either they'll leak or what if they don't find a washroom to release themselves. So is this a good thing, or they should actually go and consult with your urologist?
No. That's diapers are temporary. So you should go and consult the doctor. Diapers are continuously 24 hours. You should not use diapers because that again causes some skin reactions and all. Try to avoid during the waking hours. Use them during night hours. So you have to find out the cause, and if any effective cure is there, they have to consult the doctor. Just simply using diapers will not help.
Yeah, because many times people make diapers their integral part of their lives or lifestyle. So that you're saying is not a good practice for a long run, right? Nimisha is asking, can certain medications or pelvic or abdominal surgeries cause OAB?
Yes. As I said, pelvic surgeries like any surgery, uterus, bladder, prostate, any pelvic surgeries, they cause the denervation of the bladder. That means nerve supply to the bladder will be affected. They can cause OAB. So sometimes it's temporary, it recover within few months. Sometimes it becomes permanent also. Like we do cancer prostate surgery, sometimes it becomes permanent. So such cases we give palliative measures like pads, clamps, and all those things. Any pelvic surgery can cause.
Right. You also mentioned that surgery is also, an option and is available when things really go out of hand and, even medicines or lifestyle modifications are not helping. What surgeries are those? What do you as doctor actually do in those surgeries?
The one is, if there is any cause like stone or prostate or stricture, we try to remove that. Even otherwise also, there are slings available like incontinence or leakage during the sneezing, coughing. There are tapes available. It's simple procedure. We put a extra strength to the pelvic floor muscles, urethra, so that will be stress in the incontinence that will be avoided. There are slings available. Where the bladder, neck becomes urethra, we give a support there so that leakage will be avoided. So other than that, we have some botulinum toxin which we inject into the bladder through cystoscopy. That also gives relief for a few months. The next last result is we do what we call sacral nerve stimulation. It stimulates the nerves so that bladder comes under control. So these are the few procedures available other than treating the cause.
Right. And these procedures, these surgical procedures are minor, they need minor surgery, etc. They are complicated.
They're safe and simple.
They're safe and simple. Okay. And doctor, for example, right now the viewers who are going through this session, they have these symptoms, maybe very, very, at very low levels, but they want to reduce these symptoms. What can they do?
Yeah, the same thing old students. First thing is we have to rule out any presence of any cause for that. Once cause is not there, as I said, one is lifestyle changes and diet and medication. There are medications, we call it as antimuscarinics, anticholinergics. The medications are available. Daily 1 tablet they need to take. So effectively it can be controlled.
And many a times it happens because it's a very common thing, these symptoms of an OAB. Now, for example, one of my friends has the same issue. I'll have the issue and I'll share it with that person and he'll say, okay, I also had the same issue. I had these medicines and I got relief. So you better take my prescription and go to the chemist shop and get the medicines and you'll be...
No.
Yes.
As I said, there will be different causes, different mechanisms.
Right.
So it varies. It's not like a Ramabana for a single tablet. Yeah.
Right. So the causes can be anything. We all as an individual are different. So please go and seek doctors' help because then they'll be able to diagnose the cause and then put you on treatment as per your diagnosis. We have Abhilasha Jain, doctor, and she is asking, why all the time in my mind I have this thing that I need to go to the washroom. Whenever I'm going out, I have this thing that, okay, I'll have to go to the washroom. But when I'm at home, everything is normal. Why it's so?
That's because it's at a mental level, mind level. The people think, oh, suppose if I go outside, I may not get the proper toilet or I mean, it is public. That's why they want to finish and go. So that is anxiety. See, these things can happen even any like tension jobs, like patient waiting for an interview for a job, or a students before the exams. So these things will happen because of mental stimulation. That's it. Right. Sometimes it becomes a habitual. It becomes a habit. They keep on doing that. Yes, so we give some medications and they counsel them. That will come under control.
So they should actually also go and consult a neurologist, right?
Yes.
So the bottom line is that please don't suffer in silence. It's treatable, you'll get relief. So just don't wait and say that, okay, I'm a woman, so I'll have these complications. Oh, I'm aging, so I'll have these complications. No, you don't need to suffer. Just go and talk about it. It's treatable. That's the good news. Doctor, one more thing. You said in the beginning that, children can also have an overactive bladder. Now with kids, it's tough to, ask them or notice how many times are they going, what are the problems, especially with urination they are facing. So how to address this issue with kids?
Yeah, that actually parents should observe. Compared to their previous days, whether they're going more frequently or they're getting bedwetting more often in the night. So that are they telling any pain or burning? So those things has to observe. Then once we see the patient, we can understand that and we get some simple tests. We can diagnose. Majority of the case, it will be a infection in the children. So that leads to sensitive bladder. They don't control. We can't convince them. They keep on passing. We give some medications which gradually, with a few days or few weeks, it becomes all right.
Right. So it's important to, notice the patterns, etc. One more thing I would like to ask you is that, what are the things that people should always keep in mind? And because again, it's the causes are maybe any and everything or anything can cause this issue, but the symptoms are very, very, very common in people all across. Now, what would you like to suggest them, especially to our viewers, that please don't delay it, or what lifestyle modifications they can make? What in short, you would like to tell our viewers?
Yeah, in short, I want to tell them, watch your urination. So how frequently pass it? Daytime, normally we say if you are passing less than 2 hours once. So probably you might have OAB. Like night, if you are getting up more than 2 times, probably you will have OAB. Or if your stream is low, or if you are leaking before going to toilet. So maybe you are having OAB, just consult your doctor. That's what I advise. Don't neglect it. Maybe 1 or 2 days you neglect, but not for the days or weeks together. That's what I advise.
And many people also have this tendency of holding themselves, you know, even for example, they are in a meeting or they are in the field, they don't know where to go or how to release themselves. Is it equally bad for your bladder or your health?
Yes. So gradually, say bladder can really get this one tone weak. What you call tone in the sense, it's a contractor to the bladder. So it might lose its tone. If you are frequently over-distending the bladder, it loses its tone. So that is again bad. So don't try to postpone too long. Particularly patients who are having prostate, no, if they try to postpone, the urine gets blocked. They will have retention of urine. So don't try to postpone it as far as possible.
Okay. And there's also a term called bladder training. What it is, doctor, and how can we associate it with an overactive bladder?
Yeah, as I said, some persons it will be habitual. Like before going out or going, they want to pass urine and go, it becomes so habitual, they can't stop it. So in such case, what we do, we give some medication, along tell them, if the urine comes, don't go immediately. Try to postpone it as far as possible, particularly when you're at home. So that is called bladder retraining. Bladder training happens in childhood. So likewise, it's a bladder retraining has to be done. So such habitual things will be avoided.
Okay,
as I said, yeah, as I said, once patient has some infection or some other causes treated, that before treatment, the symptoms continue post-treatment also. In such cases, we advise them, you have to retrain the bladder along with the medications.
Okay, so that's what bladder retraining is all about. Now, is there a possibility that a person who has these symptoms, if they go and talk to the doctor, a neurologist in this case, they'll probably end up knowing that they actually have an UTI or a prostate enlargement? I mean, what I'm trying to ask is, can these symptoms actually tell a person that, see, these are symptoms, okay, fine, we'll treat you, but actually you are having prostate issue or you are having UTI, etc. So is there a possibility?
Yeah, there is possibility. There is possibility. So both can coexist also. So as I said, we diagnose and we treat according to the cause. Once we treat the cause, the symptoms will be relieved.
So it may actually happen that, you know, you are going through these symptoms, just considering maybe, you know, it's because of my age or because I'm diabetic, etc., but actually the cause is something else. So you will get treated for that as well. So it's always better. That's what we are continuously saying. Please don't ignore or neglect your symptoms. Go and talk to your doctor. Now, doctor, as we are coming to the conclusion part of this session, any takeaway message for our viewers?
Takeaway message, as I said, you watch your urination. Any little abdomen, don't neglect it. That's the reason we are doing a lot of this awareness. Incontinence week, incontinence month, internationally we are doing. So particularly in India, they keep neglecting. They think it's a part and parcel of either childbearing or menopause or old age. It's not. There will be some cause which can be treated. So don't neglect it. Take the help of the doctor. That's my message.
Right. Thank you so very much, doctor. It was wonderful talking to you. Thank you so very much for taking out your valuable time. And it has been a very informative session for our viewers, I'm sure. We really look forward for many more such sessions in coming times. Thank you.
Thank you.
And we would also like to thank our viewers for an excellent participation. And for more information and updates on the overactive bladder, please stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Insta. Thank you. Goodbye.